Hi, everyone. Thanks for joining us tonight. My name is Dr. Daniel Krona, and I'm here representing our PhD program in pharmaceutical sciences. I'll be specifically talking to you tonight about our PhD program in the Division of Pharmacotherapy and Experimental Therapeutics. So as you can see there, that's my shining face with my contact information there. I'm an assistant professor in DPET, as well as the DPET Director for Graduate Admissions. If you have questions for me, please feel free to reach out directly to my email address. Joining us tonight for the question and answer session are also Dr. Sarah Salerno, who's a third-year graduate student in DPET, as well as Jim Baudouin, who is a third-year graduate student also in the division. So just a little background on Chapel Hill. Even though Dr. Rogers was kind enough to provide us an overview, it's widely regarded as one of the best college towns, if not the best college town in America. Franklin Street is one of the town's main thoroughfares, and it borders Chapel Hill, and the campus offers plenty of shops, cafes, restaurants, theaters, houses of worship, and many other activities. We're located here at the western point of Research Triangle Park, which is home to a vibrant culture of scientific research and includes not only industry, which you heard about, but also clinical research organizations, or CROs, as well as regulatory organizations like the NIEHS and the EPA. So just UNC Chapel Hill as a whole is regarded as one of the best public universities in the nation with a strong reputation in research, and that could be in basic sciences, translational research, or clinical research. And in 2014 alone, it received more than $792 million in research funding. So we are well funded in our abilities to do impactful research for patients. Nationally and internationally, the Eshelman School of Pharmacy is well regarded. We are #1 in pharmacy within the nation, as ranked by U.S. News and World Reports in 2016. And worldwide, we are ranked as the #6 overall school of pharmacy and pharmaceutical sciences. The school is one of 5 health affairs schools on campus, which includes a medical school, a dental school, a nursing school, and a public health school. And of course, our division has very, very strong partnerships with our hospital partners, as well as regulatory agencies, and also our industry partners. So, what is the Eshelman School of Pharmacy? It is definitely one school, but is located on 2 campuses. We have a campus in Chapel Hill, of course, and a campus in Asheville. Now, if you're interested in the pharmaceutical sciences program, our PhD program, in DPET, you're not actually going to be centered in Asheville. We only have lab research programs available at the Chapel Hill campus. However, other PhD programs, most notably the program in Outcomes and Policy, or DPOP, they do have faculty that are located centrally in Asheville. Now, speaking of our other divisions and other opportunities, I'm briefly going to discuss those. We have 5 divisions, as was outlined by Dr. Rogers in the fellowship program. We have chemical biology and medicinal chemistry, and Dr. Drew Lee would be the person to get in touch with if you are interested in drug discovery or even medicinal chemistry. Pharmacoengineering and molecular pharmaceutics, Dr. Phil Smith is the right person to contact, and that would be if you're interested in basically how drugs get into the body and are delivered most efficiently, or if you're interested in nanotechnology. Now, of course, we're going to be talking mostly tonight about our division, which is pharmacotherapy and experimental therapeutics. And like I said at the beginning, I'm the one that you should contact, Dr. Daniel Krona. Later on, or going down the list, we have pharmaceutical outcomes and policy, and Dr. Delisha Carpenter is the person to contact for questions about their division. Now, we have a 5th division, which is focused on practice advancement and clinical education, or basically the practice of clinical pharmacy. However, they only have a master's degree for our PGY2 health policy residents, and they do not actually have a PhD program in that division. So in DPET, we strive to improve lives by leading the world in translating experimental and clinical pharmacology discoveries into precision medicine. We currently have 33 faculty members, most of whom are clinician scientists and experimentalists, with a few clinical trialists. Right now we have 17 graduate students, and as you heard, we have 21 fellows, postdoctoral fellows in our program, as well as 15 traditional lab-based postdoctoral research scientists. So we have a lot to offer you, not just the lab that you'd be working in, but a lot of different centers and cores that are featured here in the Eshelman School of Pharmacy, which includes our Center for Pharmacogenomics and Individualized Therapy, our Center for AIDS Research and Clinical Pharmacology, as well as their Analytical Chemistry Laboratory, the Analytical Chemistry and Pharmacology Core for the UNC Lineberger Comprehensive Cancer Center, as well as our renowned pharmacometrics program. As well, we have opportunities for graduate school or graduate students through our Eshelman Institute for Innovation, through our Pharm Alliance, which is a partnership with pharmacy schools in London, as well as in Melbourne, Australia. And then for more advanced students in their third year and beyond who are in the clinical track, we have the opportunity for you to participate in our T32 postdoctoral fellowship training program in clinical pharmacology, which is a shared program between UNC and Duke. So we have some focused areas of coursework and research, which include drug metabolism and transport, pharmacokinetics, pharmacodynamics, and pharmacometrics. We also have research in pharmacogenomics and pharmacogenetics, as well as all of our students get taught basic clinical trial design, as well as biostatistical analyses. We have some expertise in experimental therapeutics, and also in answering questions related to the mechanisms of drug toxicity. Our research focus areas include cardiology, as well as hepatology, gastroenterology, and solid organ transplant. We have expertise in infectious disease and HIV, as well as oncology and hematology. And we also have research in pulmonology, as well as pediatrics and pediatric pharmacology. So you might be asking yourself, do they have two curricular tracks? And the answer to that is actually yes. And so we have a curricular track for our post-PharmD or post-MD students, and that's our clinical track, but we also have a non-clinical track for students who want to learn more about clinical pharmacology and pharmaceutical sciences, but have not received a PharmD, MD, or equivalent degree. And how does that differ? So I'm not expecting any of you on the line really to take in full depth the coursework, but what I did want you to understand is two things. Number one, there are 4 semesters of didactic coursework as part of your training, or your graduate training in pharmaceutical sciences. And as clinical track people, you would be taking one notable course in your 4th semester, which is our DPET 822 Advanced Clinical Pharmacy. What that essentially is a class that oversees you for all 4 of your first semesters and ensures that you're meeting certain standards as part of your clinical experience that is part of the PhD program here. For our non-clinical track people, we still do have clinical opportunities for them, although they're not MDs or PharmDs that are licensed. They would still have shadowing and other clinical exposure opportunities. But to supplement their education, there are a couple of extra classes that they would be taking aside from our advanced clinical pharmacy course. So for financial support, we do have what we believe is a very competitive graduate stipend. It's well above the national average and well above the average here on our campus. So all of our DPET graduate students, regardless of track, earn an annual stipend of $30,000 a year. So what does that mean? That means you get paid to go to school. You do not have to pay for school, not like you did in pharmacy school or for some people online, medical school. You get paid to come and do research and be trained. So you receive a $30,000 stipend in the form of either a teaching or research assistantship. Now for students that come in on our clinical track, who are our PharmD, our MD, or equivalent degree, they have the opportunity to earn an extra $5,000 a year in their stipend, which is supplemented through professional service, their clinical service over at the hospital, etc. So like I said, students do not pay tuition. Your tuition is paid. And approximately $900 in student fees will also be covered by the school for you each semester. And that goes to things like health insurance through our hospital, student health clinics, as well as just being able to use the library, the sports facilities, everything like that. So, how do you apply? So one of the main things that you have to understand is that you're not applying directly to the pharmacy school. You're actually applying to the UNC Grad School. So there's additional information located at that web address, thegradschool.unc.edu. And what we'd like to emphasize tonight is that for the PY4s that are, or P4s that are considering applying, we would strongly recommend that the applications be submitted in full by December 7th. Now that's for the main reason that we would ask that you submit by December 7th is we would like to put many of you up for internal merit scholarship or meritships here at the university. They're very prestigious. They bring in a little extra stipend bonus, and it brings, like I said, prestige back to our division in the university. So a few of the other requirements as outlined by the graduate school include the GRE, which is a requirement, as well as the TOEFL for international applicants. You're going to need 3 letters of recommendation, a statement of purpose, a statement of your research experience, and or your volunteer and work experience. So I kind of answered this first frequently asked question, but is the GRE a requirement and is the TOEFL a requirement for all international students? And the answer to both of those is yes. The GRE is required for all students. Even if you have an MD, even if you have a PharmD, it is still required. And the TOEFL is required for all international students. There are a few exceptions to that, including, let's say you're an international student and you earned your MD or your PharmD from a university in the United States, you would be waived. If you did your training in a country where English is spoken as a first language, it would be waived. And if you did, or if you attended a university where English is the first language that is spoke, even if it is not the first language spoke within the country, then it would be waived. But all other scenarios, the TOEFL would be required for international students. So one of the things that we commonly get asked is, what are the factors that are considered during application? Because there's a misnomer out there that GPA and GRE are the things that make or break you in your application. And while GRE is important, and while GPA is definitely important, we also place a high emphasis on the quality of an applicant's other components, including their statement of purpose, as well as their letters of recommendation, and we certainly put a high emphasis on research experience, publications, and presentations during their undergraduate training, their graduate training if they received a master's, or during pharmacy or medical school. So that means I can't really give you what a typical successful applicant looks like. We take everything into account and we put it all in, and a high GPA isn't something that's going to guarantee admission. A high GRE isn't going to guarantee submission. What we want to do is have a nice, well-rounded group of individuals that make up our grad school or our grad student population. So what I would suggest you do, if you have questions about this, is look at the link that's provided here. And we have some benchmarks basically that show for our students over the last 5 to 10 years, what were their average entering GRE scores, their average GPAs, for international students, their average TOEFL scores, and then what were their average presentations and posters and publications that they entered with. So you could gauge kind of where you're at and maybe what you have to do to improve your application. Another frequently asked question is, if I do apply, when am I going to get an update about this? So faculty, about 8 to 10 of us in the division, will review applications during mid-December and early January. Like I said, we want to have those applications in by December 7th so we can identify our strongest candidates and put them up for internal awards with the graduate school here. Now, our strong candidates or strong applicants, excuse me, will then be invited to Chapel Hill for an in-person interview in late January. And then typically decisions on admission are made at the very latest by the end of March in that application year. So, if you're admitted, then how will you identify the lab you work in? Well, during the first year, students complete what are known as research rotations in different laboratories that will help identify which faculty members that they would like to work with. But I would suggest that if you have an interest in a particular area, whether it be one of the research areas or it be one of the therapeutic areas, that you go on our website and get to know our faculty a little bit. Just look at their profiles, see what their research is all about, look at their publication history, and then when you are writing your statement of purpose, go ahead and identify those people who you think would be the best mentors to teach you the skills that you need to have to get to the place you want to go with your career. So who should you contact if you have questions about the application process or about our DPET graduate program? That's me. You can get a hold of me at that email address that's listed, daniel.crona@unc.edu. Please, any questions you have, shoot me an email. It doesn't matter if it's multiple questions with multiple parts, or if it's just simply one small question, big or small. I'm open to them. Please reach out to me if you have any questions. And then where can you go to find more information about our DPET PhD program? So again, go to our UNC Pharmacy website, click on divisions, then click on the DPET link in the divisions tab, and then when you're in our DPET division tab, go ahead and click on the PhD program. That should give you more information about what to find about our DPET PhD program. So at this time, I'm going to welcome up the two graduate students in our program that I referenced at the beginning, and we're going to answer some questions as facilitated by one of our fellows, Dr. Tej Patel.
Okay, so for the first question, what work history or experiences would set an applicant apart from other students applying?
Well, I would say that since it is a graduate program, probably the most important thing would be your research background. So if you have any publications or if you've done research either in pharmacy school or in your undergraduate work or previous work history, I think that would set you apart and be really important for your application.
Yeah, I would agree with that. Research experience is definitely the number one thing the faculty look at. It's not the only thing. Like, there's a lot of PharmDs in the program, of course, a couple of MDs. So that kind of background definitely helps you as well. But you do not need to have a PharmD or an MD to be in the program. And yeah, there's a couple of Masters of Science students, degree holders, and there's a couple of Bachelor of Science degree holders. So there's a whole variety of applicants that can get accepted.
Yeah, I would agree with that. So I'm actually sitting here as a former graduate of our PhD program, and so I've seen a number of the candidates come in over the years, both in my year as well as other candidates that came on campus while I was a student, then while I was a postdoc, and now as faculty. And one of the main things that I think we look for and we value very highly is research experience. So I think it's important that you get out there and you have a job that teaches you about pharmacy and the practice of pharmacy. You know, one of the things that we would advocate is that you have research experience, and that comes in all sizes. It could be that you have research experience in a basic science lab where you're working with mice, or it could be that you're working on a translational project where you get to be at the interface of the clinic and the lab, or it could even be outcomes research. So research, that's one of the things that I think would really differentiate candidates when they come in.
These next two questions can be combined into one. What are the steps to preparing for the program, and when is the best time to apply for the program?
I would say the best time to apply, I think I had my applications all in by December. So the earliest is the best, and it's also important to reach out to faculty that you're interested in. Like I had already picked out who I wanted to work for before I even applied, and I think that's important to even set up a phone conversation with that person, and because you don't want to go to a graduate program and not be able to work in the area that you're interested in. So it's important to start looking in advance at the different labs you're interested in, and to make sure that you're going to be able to study what you're interested in while you're here. But try to get your applications in by December 1st.
So I did not have contact with anyone before I submitted my application. I was pretty flexible. I was interested in multiple labs. I indicated a lot of faculty on my statement of purpose, who I would like to work with. So yeah, I would recommend to start your application process as soon as possible. Don't wait till the last moment. For example, in the case of the GRE, if you want to get a higher score on your GRE, you can always do another attempt later on. So yeah, plan ahead. And yeah, so because my background is kind of different, and once I did get accepted to the program, and in preparation for the coursework, I did grab a pharmacology book and started preparing for the content from that kind of book.
So I would say that you would not want to do what I did, which was wait until you were midstream in your 4th year API rotations to decide that you want to do a PhD, and then have to scramble. That is not what I would advise. So I would like to echo what my two colleagues here have advised, which is prepare in advance. So if you're a 4th year PharmD student and you are in your API rotations, just start preparing as best you can right now. Start working on that statement of purpose, get your GRE scheduled so that you can have your scores submitted in advance of December 7th. I would get your CV in order and start asking your people who you know best to write you your letters of recommendation. Now, if you're not in that scenario, which I think would be preferable, but still is not always the case. Some people, like myself, wait till the last minute. If you're not in that and you're a 1st through 3rd year pharmacy student, then I think you've got a lot of time to really sit and think about things. I would, again, back to the previous question, start engaging in meaningful research during your pharmacy school career. And then, like my colleagues have said, really start thinking about what it is you want to get out of graduate training. So looking at the research that we offer, looking at the programs based on the faculty profiles, and then, like Dr. Salerno has mentioned, getting in touch with certain faculty members to pick their brains, and they may refer you to their existing graduate students or their fellows to kind of see what projects are going on, how their management style is, things like that. All of that is important because you are committing yourself to 4 to 5 years of graduate school training after you've already most likely completed a PharmD. So preparation is important because you're making one of the biggest decisions of your life. Now, when it comes to the application itself, like we said, it's important that so that you are competitive for these prestigious fellowships, that you get your application in its entirety in by December 7th.
How do I know which program is the best fit for me?
I would say, well, for me, when I was, there was only a few schools that were actually heavily influential in terms of pharmacometrics. So of those schools, I looked into the different faculty members, read their papers, and talked with people, and I considered the research they were doing, in addition to the opportunities that the school had, the reputation of the school, in addition to the rapport that I had with the students and the faculty members that I was interested in working for during the interview process. I think that's really important because when you work in somebody's lab, it's really important that you are able to communicate with that person and that you enjoy working with them, because you're going to be married to them for 4 years, or working with them every single day. And so I think it's, in addition to the science, that you actually really respect and like the person that you're working with.
So I just identified the top programs in the nation, applied for many different programs, and when I got to choose, I decided, or I also looked at the geographical area, climate, those kinds of things, cost of living. And so in addition to the research that is great here, I love the climate, which was another determining factor for me. So if you want to decide between the Midwest, where you will have extremely cold winters, or a very mild winter here in North Carolina, that can be an important factor as well.
Yeah, I think for me, as a starting point, I did a lot the same that my colleagues did, which is I looked at the programs sort of in generally what they offered and what they described themselves on the website. But then when it came time to interviewing, once I was on campus, it was more of a fit. How did I fit with the existing grad students? How did I fit with the faculty members, particularly those ones that I identified ahead of time? Was it a right fit? Did I get a sort of a good vibe? And what I was told going into it by basically everyone was that I would just know. I would just know when it felt right. And I went on 5 different interviews at 5 different institutions, all of which are, I would imagine, amazing programs. And when it came down to it, I just felt like Chapel Hill was the best fit. And I would have to say that I feel like I made a really good decision. We have exemplary research. We have great resources. We're one of the only institutions that I know of that has another world-class university 9 miles away, complemented by a research park that has just about everything from big pharma to small startups, as well as regulatory in the EPA and the NIEHS. So, you know, when it came to resources, I felt we were kind of second to none. And then personally, for pharmacy, it's really hard to beat UNC and the latitude of practice that pharmacists have in the state of North Carolina. So when I took everything and I summed it all up, UNC came out the winner.
Is there an added benefit coming into the PhD program with a PharmD?
I would say it kind of depends on what kind of research you want to do. It's helped me just because I'm doing more pediatric. It's very clinical, the kind of research that I'm working on. But I think that you can succeed and be just as good of a scientist without a PharmD if you're doing more basic science research, more assay and development. So I think it just depends on what you're interested in, but I don't think it's a disadvantage or an advantage necessarily. It's just, if you have a PharmD, you're probably going to do more clinical research. If you don't, then it might be harder to do clinical research if you don't have a PharmD background.
Yeah, I don't have much to add to that, except that me as someone without clinical background, I just think I would fit in most labs. I would be fine doing more clinical work than I'm doing now. Right now I'm doing pretty basic science, but I'll be involved in a clinical study as well, and I'm very excited about being involved in that kind of project. There's a big fraction of PharmD students in the program, so you might think that means there's an advantage of having that kind of degree, but it really depends on the person, I would say.
Well, I think the short answer is yes, because you get $5,000 more a year. But aside from the pure economics of it, for me, one of the carrots of the program is actually the clinical experience. And so for some students, they just do some very introductory exposure rotations, or perhaps one of their aims might be geared towards a small clinical study, whereas some students like myself engaged over the course of about 4.5 years a weekly longitudinal clinic. And if I didn't have that clinical degree plus also licensure in the state, then I wouldn't have been able to practice autonomously in the clinic. And so my clinic was the genitourinary oncology ambulatory care clinic, where I practiced for 4 years. And as it so happens, that's where I am now in my professional life. So for me, it was advantageous because I was able to build on skills from pharmacy school and then leverage my clinical experience in the program into part of my current job. So.
How long does a program take on average?
I would say probably 4 to 5 years. I don't know anyone that's done it in 3. That was my goal, but I don't think it's going to happen.
Yeah, I think like 90% of students graduate within 5 years. I think there's been one case where there was like 3 years and 10 months. Some students went into their 6th year, but that's pretty rare as well. And it kind of depends on your other obligations. Some people are like MDs and go to their clinic some days of the week, so that sort of lengthens their time in the program.
And what's the general timeline for acceptance and commitment of the program?
I think Dr. Krono went over most of that in the beginning, but you should find out pretty soon after your interview. And you should find out if you're going to get an interview probably by January or so. And then interviews usually take place in January, and you'll probably find out February-ish, March at the latest.
Are there opportunities to teach PharmD students?
There are opportunities to teach PharmD students. You can help grade some of the SOAP notes. There's plenty of opportunities. You can always ask if you can TA a course. It's just depending on how busy you are with your research. You don't want to spread yourself too thin. But there's opportunities. I'm not sure of that many graduate students that have been too involved with teaching pharmacy.
So when I was in the program, I taught, and I started small. So I taught in small SOAP note type courses where I had, 10 or so PY1s, and then I graduated up to PY2s and PY3s. So started small, and then in my later years, I had full lectures in oncology in both our oncology module, so I taught the prostate cancer lecture, and then in our oncology elective, I taught the genomic profiling lecture as well as the kidney cancer lecture, and I did that for multiple years, which was nice because teaching was and still is a passion of mine. One of the other opportunities other than teaching PharmD students is being able to teach graduate students. And if you do well as a TA, as Dr. Salerno mentioned, you have the opportunity to TA. Some of the course directors in the second year may let you come back and teach a guest lecture. One of the classes is learning how to apply biostatistics to clinical research scenarios. And it has actually the lecture portion as well as a hands-on SAS portion. And the advanced graduate student is able to sort of teach through the programming recitation if they're so interested. Last but not least, I think one of the advantages, to go back to a previous question, is the advantage of having a PharmD entering the program. And if you enter with the PharmD and have actually licensure, and you have the desire to, you have the opportunity to precept PharmD students at health fairs, as well as their student-run health clinic. It's called SHAC. It's in Carborough, where you get medical students, nursing, pharmacy, dentistry, PT, respiratory, everything. They're all precepted by attending professionals that are in their respective disciplines, but yeah, you'd have the opportunity to precept those students as well at the SHAC clinic. So lots of opportunities, but I'd like to emphasize what Dr. Salerno mentioned, which is don't get yourself spread too thin. There's opportunities galore here to feed your passions, but it's easy to get diverted from your research endeavors. So I think balance is actually the key to being successful in that area.
Do you encourage your students with the PharmD to work as a pharmacist?
I'm gonna answer this one as the DDGA. I'm gonna put on my division director hat right now instead of my former PhD hat. We would say no. You buy the book of our handbook, have the ability to work PRN as a pharmacist at a retail chain or whatever, or an independent or something like that, 10 hours a week maximum. Because it's kind of viewed that if you're working as a pharmacist, you're not real serious about becoming a researcher. So we give you the opportunity to supplement salary at 10 hours maximum a week, and that has to be okayed, but first by your research mentor, and then later on by your dissertation committee. However, I had mentioned earlier the clinical experience. So if you're interested in practicing pharmacy, you're interested in clinic, then you can take a more active role in your clinical experience. So that would be some place where the program would actually support you working as a pharmacist, albeit as a trainee over at the hospital.
I just have to say that, yeah, you definitely can. I know people that have worked as a pharmacist, but I feel like if you want to be a competitive graduate student, you really need to work all the time. And I mean, on the weekends, when I just can't imagine having a part-time job, because I feel like there's so much I should be doing for my research project that at the end, if I have a few hours, I just kind of want those hours to myself.
Are there any scholarship opportunities? Spoke to them earlier during the...
Yeah, so if by scholarship it's meant, are there scholarships to offset costs like you would have in your pharmacy program or your undergraduate? That shouldn't be a concern to you, because you are not having to pay either for school or for fees as part of the program. You're actually getting paid to come and get a degree, which is kind of opposite from what you've experienced to this point. Now, there are opportunities for fellowships and awards, which do come with them monetary prizes. So fellowships being anything from, ROCI and PLS have fellowships as you're going into between your PY4 year and your first year in graduate school. There is the American Foundation for Pharmaceutical Education, or AFPE, which have fellowships for existing grad students. And then there are fellowships on campus as well as through the NIH, which help supplement your stipend. And with them come an added bonus. With every amount of money you bring into the program, you get X amount of dollars back to help raise your stipend. So there's plenty of fellowships, but scholarships not sort of applicable in this situation.
We have time for one more question. Sure. I would like to hear from the PhD candidates who have a PharmD and see what the advantages are to holding both degrees and what their plans are for using this combination of degrees.
I would say I'm a little bit in contrast to Dr. Krona. Even when I was in pharmacy school, so I did the research track. In my pharmacy school at UCSF, we actually had a track where you, instead of doing all of the rotations, you could do a research project. And so I always knew that I wanted to do clinical research. And so I've focused more in clinical research since I've been here, because that's what I'm most interested in. So the advantages are, if you're doing PK modeling, it's very easy to just, look at all these different covariates, but if you don't have the clinical context for what is going to be a useful covariate that a physician's going to want to use to optimize dosing in the hospital, I think it helps give you the context to make sure that the research that you're doing is more broadly and clinically applicable.
So since it's our last one and I am the contrast, I'll put back on my hat and speak to it as when I was in the PhD program here. So I think that it most certainly gives you clinical context and the ability to practice. I don't think that you need to be as aggressive in practice as I was. Obviously, Dr. Salerno is not, and that's okay. It's different strokes for different folks here, and we welcome all comers. However, I do think that it does allow for some latitude in your future career goals. So if you want to have a career in basic sciences, we got you covered because you'll have your PhD. If you want to have a career in translational sciences, I think we got you covered because you will have a PharmD and a PhD. But if you want to have a career in clinical research, not to say that you can't without a PharmD or an MD degree, it's a lot easier to have access to the clinic when you have that clinical degree with licensure that is then supplemented by a research-based degree. That being said, there's also opportunities for PharmD and MD trained people in both industry as well as in regulatory that sometimes are not available to people without clinical degrees. So I don't see much difference especially by the later years of our grad students in terms of their scientific abilities and knowledge. But then when we get ready to graduate or defend, sometimes the students without the clinical degree have fewer opportunities. Now, that being said, I also would think on the flip side that having a PhD sometimes has advantages over and I'm not saying just to marginalize, because fellowships are very, very rigorous, but just having the fellowship sometimes does not allow a PharmD trained researcher perhaps the same opportunities. So for example, I know that I would not have been able to have a clinical practice as well as a laboratory practice had I not had both degrees. So again, thank you for attending this evening. I'd like to thank Dr. Patel for staying a little late. I know he has a busy morning tomorrow at GSK. And I'd also like to thank my colleagues Jim and Sarah for attending and helping answer questions. If you have extra questions, feel free to tune in again on Thursday. We're going to have fun and we are lively. If you have specific questions about the program for me, or if you wanted to ask Jim and Sarah a couple of questions about their experiences as grad students, you can definitely send them to me and I will funnel them on to them. But thank you again for attending, and we look forward to your application.